My name is Melinda Isbell, and this is my Change Project Proposal assignment for the Nursing Department of Athens State University. Nursing 440, Leadership and Management Practice, led by Dr. LaToya Sullivan. My Change Project proposal is on the addition of routine fingerstick blood sugars performed in the emergency department triage for the rapid identification of hypoglycemia. I do certify that I am the sole author of this assignment. The information contained is my own. I quoted appropriately using the APA 7th edition standards. I do submit that the information was prepared by me for this assignment and it has not been previously submitted. Hypoglycemia is generally defined as a blood glucose level less than 70 milligrams per deciliter. A current problem we have at my facility is not catching low glucose levels immediately on emergency department patients. I feel like we could improve patient outcomes by obtaining fingerstick blood sugar levels in triage on anyone who complains of dizziness or confusion. Identifying low blood sugar levels as a cause of symptoms can increase the efficiency of the care that is received in the ED. When we identify such an easily correctable problem early on, it allows us to administer effective medications earlier. Early identification also provides a financial savings to the hospital as well as to the patient, as it can eliminate the ordering of unnecessary testing. For example, it is not uncommon for a patient complaining of dizziness to be scheduled for a CT scan of their head immediately by the treating physician. But say a patient had a fingerstick blood sugar in triage that showed a glucose level of 50. That same physician may treat the low blood sugar first to see if the symptoms resolve before moving on with more extensive, costly workups. As nurses, we oftentimes get caught up in the policies, which is not always in our patient's best interest. Triage nursing requires being able to assess a situation and make an initial diagnosis rather quickly of the scope of needed treatment. Legal concerns come into play when we perform a triage or initial assessment and place a patient back out into the waiting room. We could very easily miss a low blood sugar, which can turn into a deadly circumstance very quickly. Hubert and Joseph identified power as the capability of producing an effect, usually associated with the ability to influence the use of resources. Influence is an informal aspect of power that is not necessarily sanctioned by the stakeholders of an organization. Managers can use multiple strategies to influence behavior. These strategies can range from positive tactics, such as giving praise and encouragement, to oftentimes negative tactics, such as threats or assertive behavior. Stakeholders are those who are impacted by the decisions made by the practices of the hospital. Those impacted by the addition of fingerstick blood sugars in triage would include the staff performing the procedures, the physicians, and the patients themselves. Potential positive impact to the stakeholders would be increased quality of care. Potential negative impact to the stakeholders would be an increased time needed to complete triage, as well as potentially performing unnecessary procedures. We can use the 5 whys tool to determine a root cause analysis for why it is taking a long time to get those blood sugar results on patients in the ER. As we look through the 5 whys, we recognize the delay in blood sugar results is occurring because the fingerstick blood sugar is not performed actually in triage. The reason we're not performing the fingerstick blood sugar in triage is because we simply do not have enough time as nurses. Our next why is, why do we not have that time? We realize that we have too many patients to be triaged efficiently. So why are we not triaging faster? This gets us to our final root cause, which is not enough staff to handle the triage volume. Team members I included for this collaborative change project proposal include a fellow coworker, Mary Priest, RN, BSN, and our department manager, Lincoln Taylor, MBA. Nurses today are very much accustomed to changes in their day-to-day environments. However, change at an organizational level, especially when it comes to policies and procedures, can be difficult to accept. Kurt Lewin, a social psychologist who introduced the work of change theories as early as 1947, believed there were three elements for successful change: unfreezing, moving, and refreezing. Those three ideas were further developed by the Lippitt model in 1973 to identify 7 phases of the change process. After diagnosing the problem, the change agent, or the person that encourages others to change behaviors or actions, not only assesses the motivation of others to change, but also the resources available and the capacity for a process to change. The change agent identifies objectives and chooses an appropriate role for themselves in the process. As the change agent for this project proposal, the responsibility falls on me as an RN to not only educate our triage staff on the new fingerstick blood sugar policy, but to ensure the policy is carried out once it has started. After brainstorming with Mary Priest and Lincoln Taylor, we determined that in order to improve our success rates of identifying those patients with decreased blood glucose levels in triage, there would need to be a new policy in place in regards to those patients who present with confusion or dizziness as their primary complaint. Hypoglycemia, or a blood sugar level below 70, is a common problem in patients who take prescription insulin. Occasionally, low blood sugar occurs in patients who are not diabetic. Complications of low blood sugar can include dizziness and an increased heart rate if the glucose levels dip too low, or if they stay in a low range for a prolonged period of time. Hypoglycemia can be life-threatening. This occurs because your brain needs a continuous supply of glucose to function properly. Identifying low blood glucose levels quickly allows rapid treatment that improves patient outcomes. The main goal for My Desired Change is to rapidly identify hypoglycemic levels during the triage assessment. The SMART objective for My Desired Change will be specific in that we'll target all patients who present to the ED with complaints of dizziness or shakiness, especially those with a history of diabetes. It will be measurable in that we will track those chief complaints of dizziness and compare them using chart checks to determine if a fingerstick blood sugar was performed. We feel as a team that it's an achievable goal. We also feel it's very relevant to the care we're providing in our emergency department. The time frame we are giving this goal is 6 months, after which time of 6 months monitoring, we will perform chart checks to evaluate compliance. In order to complete a force field analysis of this change project proposal, we need to evaluate both the driving forces and the resisting forces we will encounter. Driving forces that will motivate others to adopt change include improved patient outcomes, which leads to high satisfaction from our physicians as well as administration. There will always be a level of hesitancy when a new policy is implemented, and the time it will take to stop and perform a fingerstick blood sugar in triage could be a potential cause of resistance. Re-educating our nurses on the importance of early intervention in hypoglycemia will hopefully strengthen the driving force. Ensuring there are extra staff and resources in place to add the fingerstick blood sugar protocol should decrease the resistive forces to this change. We mentioned Kurt Lewin earlier in this presentation. Lewin's change strategy uses the term planned change. This implies that groups and organizations' change comes not as accidental, but as an intentional change that is supported by the group. Creating motivation for change is the first step, as well as the education for the need to change. Successful change also requires exposures to the change ideas and the collective sense of working together to solve the identified problem. Lewin's change process coins this as the unfreezing stage. Once the group has generally accepted the need for change, Lewin's second stage is moving, which is the actual carrying out or implementation of the new policies and procedures. The final change stage occurs when changes are integrated and the members of the group feel as if the new process is successful and stable. This stage is known as refreezing. Our desired change will be implemented in several specific steps. The first step will be educational material on hypoglycemia that is printed and posted around our department. These printed flyers will also include information about a huddle meeting scheduled for the first of the month, where we will present the educational material verbally and introduce the proposed plan for triage. We will provide a time for verbal feedback as well as electronic communication for the staff to share concerns. Our staff assignments will be adjusted to include a patient care tech to the triage areas to help decrease the added workload. For a period of 6 months, we will request the registered nurse to keep a log of all patients who present with dizziness or shakiness and the associated fingerstick blood sugar result obtained in triage. At the end of the 6-month period, we, as a collaborative team, will go over those results to evaluate the percentage of times that a fingerstick blood sugar was appropriately obtained. We expect a 90% success rate from our triage nurses. Everett Rogers presented the theory of innovation, which describes a process through which a group accepts changes. His theory included 5 steps, which starts with the knowledge of a change process and ends with confirmation of that decision. Rogers identified that members of a group fall into several different categories, from innovators, who identify the problem, early adopters with little resistance to change, early to late majority adopters who tend to just side with the group, and finally laggards who are the last to accept change. Progress for our project will be monitored not only using the 90% success rate over a 6-month time period, but also with follow-up interviews with nursing staff and our physicians to evaluate acceptance and feasibility of this change proposal project. Thank you for your time and attention as we consider this change proposal process. As someone who doesn't struggle with change, I often forget that change can be very difficult for some people. This project taught me that taking strategic steps can reduce resistance and increase the likelihood of successful change implementation. I feel as if the addition of performing fingerstick blood sugars in triage will benefit our emergency department, and feel confident that the education and additional staff we provide to help facilitate a smooth transition will increase the chance of the change's success.